This is Klahn's clinic on glaucoma. Oh, wait, no, let's try that again. This is Klahn's clinic on glaucoma. In this video, you will learn about relevant eye anatomy, causes, symptoms, diagnosis, treatment, and complications of glaucoma. The eye, as you know, is what we use to see. What you probably don't know is what makes up the eye. Starting at the front, the cornea is the clear layer allowing light into the eye. Then comes the iris, which is responsible for controlling the size of the pupil by contracting or expanding depending on light intensity. And the final front structure is the lens, which takes and focuses the light so it can be sent to the retina in the back of the eye. The retina changes the light into an electrical signal, which is then sent to the optic nerve so it can be processed by the brain. Moving back to the front of the eye, there is a fluid called the aqueous humor. Production of this fluid begins in the ciliary body, filling the posterior chamber, which then goes through the pupil and into the anterior chamber. At the bottom of the anterior chamber, there is a network of openings called the trabecular network. These pores drain into the canal of Schlemm, which leads the fluid into the bloodstream. This cycle continues to keep the fluid clean and to maintain the eye's internal pressure, which is vital to its shape and function. Glaucoma is usually caused by the disruption of the flow of aqueous humor. The fluid is somehow blocked and builds pressure from the lens up. This pressure will then push back on the lens and increase pressure in the back of the eye, affecting the light-sensitive tissue in the retina and ultimately leading to irreversible damage of the ocular nerve. I say usually because there are multiple types of glaucoma, all with their own causes. The most common type of glaucoma is open angle. Here, the trabecular network is partially blocked. The aqueous humor is still able to return to the bloodstream, however, the rate at which it does is not fast enough. This slowly builds pressure up within the eye. The pressure is so gradual that symptoms come on so slow, making them almost unnoticeable. The pressure begins by affecting the peripheral vision and working its way in to the central vision. Closed-angle glaucoma can either be chronic or acute. This variation affects the drainage angle, which is the space where the iris and cornea come together. When the drainage angle is smaller than it should be, the trabecular network is affected, and like open-angle glaucoma, the aqueous humor cannot flow properly and slowly builds pressure. However, this is only true for the chronic closed-angle glaucoma. Acute closed-angle glaucoma is a medical emergency and needs to be corrected immediately. For any reason, such as the iris bulging forward after a rapid dilation, the eye can no longer drain the fluid and pressure builds up quickly. When this happens, headache, eye pain, nausea and vomiting, blurred vision, halos around light, and eye redness may occur. The third type of glaucoma is pigmentated glaucoma. Pigment granules that give the iris its color may come off and get carried by the aqueous humor to the trabecular network, where they can get stuck. When they get stuck, they obstruct the flow of aqueous humor, and I'm sure you know what happens next. There's more pressure, more damage, and less seeing. The exception to the usual causes of glaucoma is normal tension glaucoma. Unlike every other type, the pressure isn't what causes the damage. Instead, lack of blood flow to the optic nerve or overly sensitive nerves in the eye will begin to die and lose some of their functionality. However, these symptoms end up being the same as open-angle glaucoma anyway. An early diagnosis is vital in order to save as much vision as possible. To test the intraocular pressure of the eye, a tonometry will be performed. Here, a tonometer is pressed on the cornea and will measure the resistance that it comes in contact with. Anything over 22 millimeters of mercury is considered high. This reading can have a considerable amount of error due to the thickness of the cornea. Therefore, a pachymetry needs to be done to measure the cornea's thickness. A pachymeter will display the thickness of the cornea on the screen. A thinner cornea will give you a lower pressure reading, and a thicker cornea will give you a higher pressure reading. To determine the extent of your vision loss, a vision field test will be performed. These pictures show the result of one of these tests. The darker areas mean that there is less vision there. The dark spot on the normal eye is due to an anatomical blind spot caused by the optic disc. This is not due to any sort of damage. To distinguish between open angle and closed angle glaucoma, the drainage angle will be measured by agonioscopy. With the help of a light and slit lamp, they will be able to measure whether or not the drainage angle is suitable for flow. Unfortunately, glaucoma is not curable. What has been done is done, but treatment is able to prevent further damage. Medications are taken in the form of eye drops, all with similar effects. Progestins and alpha-adrenergic agonists both decrease aqueous humor production and increase drainage. Beta blockers and carbonic anhydrase inhibitors both reduce fluid production. And miotic and cholinergic agents increase drainage. Surgically, a few options do exist. Laser trabeculoplasty will use a laser to open up the trabecular network. A trabeculotomy or trabeculectomy creates an opening in the white of the eye so the fluid can have another pathway to drain, depositing the fluid on the outside of the eye. Drainage tubes can transport some of the fluid to a reservoir on the surface of the eye so that it can be picked up by the vessels around there rather than just the ones in Schlemm's canal. Finally, for closed-angle glaucoma, the laser peripheral iridotomy will use a laser to cut a small hole in the iris so that the aqueous humor can escape through that instead of through the pupil, which may be blocked. Complications of glaucoma are minimal but severe. If glaucoma is not treated, you will progress from tunnel vision to complete blindness. In fact, glaucoma is the leading cause of blindness worldwide, with a projected 80 million suffering from glaucoma and 4.5 million going blind because of it by 2020. In conclusion, this kind of humor isn't too funny. That's all I have for glaucoma. If you haven't already, subscribe to me on YouTube, DTube, or follow me on Twitter, or heck, do all of them. If you want to see my previous video on benign brain tumors, that will be down in the description. I have no planned video for next time, so it'll be a surprise. But until next time, stay healthy.